Hi, happy morning, everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your exams. Every day we are seeing 5 important MCQs for the exam of AIIMS, as RRB as well as JIPMER. Okay, we'll start today's session with the 5 important questions. Before that, we'll start with a small quote. One important key to success is self-confidence. An important key to the self-confidence preparation. ஸோ சக்ஸஸ் ஆகிறதுக்கு மெயினாக உங்களுடைய தன்னம்பிக்கை ரொம்ப முக்கியம். அந்த தன்னம்பிக்கை எப்படி வரும்னா, நீங்கள் கண்டினியூஸாக ப்ராக்டிஸ் அண்ட் ப்ரிப்பரேஷன் பண்ணும்போது தான் தன்னம்பிக்கை வரும். ஓகேவா? ஸோ டூ மோர் ப்ராக்டிஸ், மோர் ரிவிஷன், மோர் ப்ரிப்பரேஷன். ஸோ யூ ஆட்டோமேட்டிக்லி யூ வில் கெயின் த செல்ஃப் கான்ஃபிடன்ஸ். Okay, we'll start today's session. Today we are going to see a clinical based, that is scenario based as well as clinical based questions. Okay, first question. The nurse J is performing wound care. Which of the following practices violates a surgical asepsis? So that means the nurse is doing some wound care. Okay. They are not mentioned what type of wound at all. That is not a matter. So the key point is here is violating the surgical asepsis. That means it's a sterile procedure. So you can assume like that. So the key point is surgical asepsis. So the options they are given: holding sterile objects above the waist, considering a 1-inch edge around the sterile field as being contaminated, pouring solution onto a sterile field cloth, opening the outermost flap of a sterile package away from the body. So the correct option according to this scenario and answers, it is pouring solution onto a sterile field cloth. So remaining A and B, D and all normal proper aseptic techniques. That means holding a sterile objects. Anything is above the waist, it is considered as sterile. Okay. Anything below the waist, it is considered as clean or contaminated. Clear? So considering a 1-inch edge around the sterile field is being contaminated. So whatever the edges around the sterile area, 1 inch, it is considered as a contaminated area. That is also right. Pouring solution onto a sterile fluid cloth it is wrong in the surgical asepsis. What will happen? When pouring a solution onto a sterile fluid, the clothes get wet. So whenever there is a moisture or wet, there is a chance for asepsis, sorry, not sepsis, and penetrating the cloth can carry a microorganism. Clear? So that is why it is a wrong answer. Opening the outermost flap of a sterile package away from the body, it is the correct. That's why that's how we are do while we are doing the dressing also, or we are helping the physician also, we will open the outermost flap away from our body. We have to open it. That is only the outermost layer. Innermost layer will be opened by the whoever doing the dressing. Clear? So that is why option C is incorrect. It is violating the surgical asepsis. Got it? Yes. The nurse May is caring for an elderly bedridden adult to prevent pressure ulcer. Which intervention should the nurse include in the plan of care? The question is talking about elderly bedridden adult. Elderly. So what as a nurse would include in the plan of care to prevent the bed sore? So the options: turn and reposition the client at least once in every 8 hours, vigorously massage the lotion into bony prominence, post a turning schedule at the client's bedside, slide the client rather than lifting when turning. So the correct option is option C. Post a turning schedule at the client's bedside is a correct option to prevent the bed sore. Option A, coming to the option A, everyone knows that positioning for the bedridden patient is every 2 hourly, right? So this option A is incorrect. Vigorously massage the lotion into the bony prominence. No, you can apply the lotion, but not vigorously. Very gently we have to apply. Otherwise, what will happen? Capillary damages can happen in the bony prominence. Okay. Vigorously, if you rub the lotion in the bony prominence, what will happen? The capillaries in the end part will chance for getting damage. So option D, slide the client. No, we have to lift the client. If you slide, there is a chance of friction. So we have to avoid the slide. We have to lift the patient. That is the right option. Okay. So, but here they're given slide the client. No, you should not slide the client. So option C, what they're telling, post a turning schedule at the client's bedside. So some hospitals, they have an alarm. A small mimicking alarm will be there. Every 2 hourly, they will get an alarm regarding the positioning. Either in the nurse's station or in the bedside, they will get a alarm. This is time for positioning. This is a time for positioning. Every 2 hourly, this alarm may happen in some foreign hospitals and all. In India, they have the scheduled list will be there. Each time after doing the procedure, you can give a checklist like thing will be there. You can tick it. So that is a correct method of to prevent the bed sore or a pressure sore. Okay. Yes. Third question. The nurse is assessing for the presence of cyanosis in a male dark-skinned client. The nurse understands that which body area would provide the best assessment. So the patient is dark-skinned client. So how can we assess the cyanosis in a dark-skinned client? The options they are given: lips, sacrum, earlobes, back of the hands. So the correct option is lips. Okay. Lips is the correct place where we can assess the cyanosis in the dark-skinned client. Why? Because remaining sacrum, earlobes, back of the hand, everywhere the dark-skinned people's skin tone will be darkened in color, except lips. Okay. So when the patient is even dark in color, what will happen if they're getting a cyanosis? The lips become gray in color. The palms and soles and conjunctive also we can assess in the dark people, and the nail beds also. There will be a bluish pink color will be there. Bluish color changes will be there. So first they are given the options here, it's the lips. If they're given the palms, soles, tongue also, you can see it. Okay. Conjunctive also, nail beds also. So according to this scenario and answer, the correct answer is lips. Okay. Next question. Which of the following individual is least likely to be risk of developing psoriasis? You know that's what is psoriasis. So which is the key point is least likely. That means very less, very rarely. So the option is a 32-year-old African American, a woman experiencing menopause, a client with a family history of the disorder, an individual who has experienced a significant amount of emotional distress. So the correct option is option A, a 32-year-old African American. Why? The dark peoples are having the less incidence getting psoriasis. So the study is saying that so whoever the darker people, they are the less chance of getting the psoriasis. Okay. Remaining B, C, D are emotionally disturbed patients. Hormonal changes are there. Okay. Systemic illness are there. So they are the more prone to get an psoriasis rather than the dark skin tone patients or a person. Clear? Yes. Option 5, sorry, question 5. Which of the following clients would least likely be risk of developing skin breakdown? Okay. Least likely. The question is least likely. A client incontinent of urine and feces, a client with chronic nutritional deficiency, a client with decreased sensory perception, a client who is unable to move about and is confined to bed. It's a little tricky questions, but if you concentrate more precisely, you can answer these questions. So the correct option is option C. Why? Honor this option, all four options are risk for getting a skin breakdown. The question is least likely. So least likely will be the option C. Why? Because I'll tell you, a incontinent of urine and feces, there is a continuous dribbling of urine and feces. There is a chance of skin irritation and there is a skin breakdown chances are there, right? So that is why option A is not least likely. Next, coming to the client with chronic nutritional deficiency. So when there is a lack of proteins and minerals and vitamins in all over the body, they are more prone to get skin damage when compared to other patients, right? Option D, a client who is unable to move, that is bedridden patient. They are more prone to get a skin breakdown, right? Here, option C, even though there is a decreased sensory perception, still the patient able to move, right? There is no incontinence of urine. There is no nutritional deficiency, but the patient able to move. So that is why they are least likely to get a sensory perception. Sorry, risk of skin breakdown. That is why option C is a right option. You got the point? Yes. Right? So when compared to other patient, option C is least likely to risk of skin breakdown until they are going to touch some hot vessels or hot part, or they're exposed to the more colder places, then only their chance for the uh, skin breakdown, right? So until they are least likely to be getting the skin breakdown. Yes, I hope you like the class. If you like the class, please press like button and give the comments. And who are all not subscribed to our channel, please kindly subscribe and support us so that we will motivate and will put more questions. As I earlier said, when we get touch 20K subscriber, definitely this 5 questions will be converted into 10 questions. Thank you all and all the best for your exams.